Good evening to everyone and welcome to today's session. Dashrath and many more who are all online. Every Sunday we have a full-scale grand test followed by a discussion. If you take the test, attend this session, it will be a great use for all of you because you have come to know what topics are you losing marks, what topics that you need to improve. That is the most essential thing when we are preparing for the NEET PG and FMG. So every Sunday, religiously, we conduct a full-scale grand test. So please take every opportunity to join the test. So doctor, let's look last Sunday, May 31st. What were the questions and how you have answered? Yeah. What is the vessel marked by an arrow in this image? So typically, you are seeing the internal carotid artery. So internal carotid artery is identified because it is the one of the components of the cavernous sinus is what you have to emphatically remember. Sternoclavicular joint belongs to which variety of joints? Keep punching your answers, doctor. So we are now discussing the NEET PG full-scale grand test. Every Sunday that we take the test on onlinembbs.com. So sternoclavicular joint belongs to the saddle joint, like a horse rider sitting on the saddle. The opposite surfaces of the individual bones are concavo-convex and convexo-concave, respectively. That's the reason this is an example of saddle variety of joint is what you need to emphatically remember. Pronator teres, which nerve pierces? Pronator teres. Median nerve is the one which pierces. I will really appreciate if you keep punching your answers, doctor, so that every live online interactive session is an interactive session in a true sense where the teacher and students, irrespective of geographical distances, we have students pan-India. We feel very happy to meet you all. So keep punching your answers. So median nerve pierces basically enters the forearm by passing between humeral and ulnar heads of the pronator teres is what you need to basically remember. Facial nerve supplies all these muscles except which one? Beautiful question. Posterior belly, stylohyoid, platysma, all the second branchial arch derivatives are all innervated by the facial nerve. But anterior belly of the digastric is the one which is derived from the first pharyngeal muscle arch. So it is supplied with the mylohyoid branch of the inferior alveolar nerve, which is the branch of the mandibular nerve, which is the nerve of the first pharyngeal arch, is what you need to basically remember. What structures pass through the jugular foramen? One of the favorite questions. Inferior petrosal, sinus, glossopharyngeal, internal jugular, they all are the contents of the jugular foramen. Favorite question. Whereas facial nerve passes to the internal acoustic meatus along with the vestibulocochlear nerve is what you should emphatically remember. The ability to recognize an unseen familiar object which is placed in the hand. It speaks about the integrity of which pathway. You should remember this sense is called stereognosis. Typically, it is an important function of the dorsal column in the medial lemniscus system. This is an important function of the dorsal column medial lemniscus system. Mia Umar is asking, sir, why class don't occur daily these days? And only one ortho-incus teacher taught one day. You have many more teachers who are coming ahead to form a communion, the dream teacher group, to deliver the sessions for you. But most of the clinicians, they are very busy clinicians. So that is the reason they will take, we need to adjust with their schedule. But Dr. Ravi Kiran is an excellent orthopedics teacher. So he is going to take almost 40 hours of time before he discussed in a detailed way almost 1,000 questions in orthopedics. So, doctor, stereognosis is dorsal column. Dorsal column means what? Vibration and proprioception. And dorsal column is not decussated to the contralateral side in the spinal cord. So, only when it reaches the lower part of the medulla, typically it goes to the opposite side. It undergoes a decussation and continues as the medial lemniscal system is what you need to basically remember. The spinal tract, which is involved in the control of the trunk muscles. See, you have trunk muscles, appendicular muscles, and axial muscles. So, which one controls it? It is the ventral corticospinal tract, which controls the trunk muscles, is what you have to basically remember. The sensation which is produced by a wisp of cotton on one's fingertip, who mediates that? It is the ventral spinothalamic tract which mediates. It is the light touch. Wisp of cotton touch is light touch. And it is basically produced by striking on a glabrous skin with a wisp of cotton clinically for you to make the diagnosis. First order neurons of the ventral spinocerebellar tract. Typically, where do you find them? If you look at the muscle stretch reflex, the moment you tap on any tendon, the tendon becomes stretched. So, the muscle stretch reflex afferent limb, that is the one which is carrying the sensation from it. Typically, the first order neurons of the ventral spinocerebellar tract, they provide the afferent limb for the muscle stretch reflexes is what you need to basically remember. So between L1 to S2, they are found in the dorsal root ganglion and the synapse on the spinal border cell. That's what you need to remember. Acute stage upper motor neuron lesions. Typically, upper motor neuron lesions means what? Upper motor neuron means you will expect spasticity. Am I right? Lower motor neuron is areflexia and flaccidity. So, but when upper motor neuron lesion is in the acute stage, that situation is called spinal shock. So during the acute stage, there will be a transient spinal shock. During that time, though it is an upper motor neuron lesion, instead of spasticity, you find flaccidity. So flaccid paralysis, areflexia, hypotonia. So these are all the things that are seen transiently when there is an acute stage of the upper motor neuron lesion in the spinal cord injury, is what you need to remember. Which tract contains axons from the giant cells of Titus? Very good to see 21 online students. So axons from the giant cells of Titus. So you should remember vestibulospinal tract. It contains the axons from the giant cells of the Titus, is what you need to remember. Typically, giant cells of Titus are found in the ipsilateral lateral vestibular nucleus of the pons. And what is the important role of the vestibulospinal tract? You all know. Rubrospinal, reticulospinal, tectospinal, vestibulospinal. These four tracts are called extrapyramidal tracts. Extrapyramidal tracts. That's the point you need to basically appreciate. Now, which tract in the upper extremity is the upper extremity equivalent of the tract that arises from the cells of the clock? Cuneo-cerebellar tract. Continuously cerebellum want information. What is happening in the spinal cord. So cuneo-cerebellar tract is the counterpart of upper extremity counterpart. So there is a dorsal spinocerebellar tract. It arises from the cells of the Clark's column. Cuneo-cerebellar tract arises from the accessory cuneate nucleus, which is a homologue of nucleus of the Clark, is what you need to understand. Which tract conveys the nociceptive input? Nociception means pain. Nociceptive input from the contralateral side of the body. It is the lateral spinothalamic tract. Obviously, lateral spinothalamic tract, the moment it is originating, it undergoes decussation to opposite side and travel up. Unlike the dorsal columns, which continue ipsilaterally until the lower part of the medulla. Now, axons from the giant cells of Betz, they constitute which tract? They constitute the pyramidal tract. Pyramidal tract is also called lateral corticospinal tract, which is otherwise upper motor neuron. Pyramidal tract. Ipsilateral pain fibers that have their second order neurons in the dorsal horn. Which tract contains that? It's called the Lissauer tract, which contains the ipsilateral pain fibers whose second order neurons are there in the dorsal horn. So it is also called the dorsolateral tract of Lissauer. It carries the ipsilateral pain fibers whose second order neurons are there in the dorsal horn, is what you need to remember. Once more, doctor, if you are continuously getting clean bowled in this topic, you should remember long tracts of spinal cord. Barabar? Long tracts of spinal cord. There is no question paper without it. Out of 20 to 25 questions that come from physiology, one question invariably comes from the long tracts of spinal cord. Take it as my word. Which tracts project to the cerebellum via inferior cerebellar peduncle? So you should know one thing, doctor. You have the brainstem. What does brainstem have? Midbrain, pons, medulla. And here you have the cerebellum. So midbrain to cerebellum, you have superior cerebellar peduncle. Pons to cerebellum, middle cerebellar peduncle. Medulla to cerebellum, inferior cerebellar peduncle. That is how the brainstem is connected with the cerebellum. So, typically, dorsal spinocerebellar tract brings information from all your spinal cord. It goes through the inferior cerebellar peduncle and informs the cerebellum. It will inform. So, the dorsal spinocerebellar tract reaches medulla and through inferior cerebellar peduncle goes to the spinal cord and informs the cerebellum about what is happening in the spinal cord. So which tract mediates pain and temperature sensation? All of you know, lateral spinal thalamic tract, no big deal. Precentral gyrus. What are the cells of origin? Typically pyramidal tract, lateral corticospinal tract. The cells of origin are found in the precentral gyrus is what you need to basically remember. Which tract mediates 2-point tactile discrimination? You close the eyes and if you are touched with 2 points, you should know they both are differentiated. It is the cuneate fasciculus. Hand means upper limb means cuneate. So, from the hand, it is the cuneate fasciculus which mediates the 2-point tactile discrimination is what you need to understand. Which is the tract where myelination is not fully achieved until the end of the second year. Typically, if you take the lateral corticospinal tract, pyramidal tract, myelination will not be achieved until the end of the second year is what you have to remember. So that is the reason those children who are less than 2 years, even though they don't have any cerebrovascular event, still Babinski's sign may be elicited normally in less than 2 years child is what you should appreciate. Transection results in spasticity. Which tract? It is the lateral corticospinal tract, which is called the pyramidal tract, that lead to spasticity. Extrapyramidal tracts, rubrospinal, tectospinal, reticulospinal, vestibulospinal, they all lead to rigidity. Whereas spasticity is caused by pyramidal tract, which is lateral corticospinal tract is what you need to basically remember. Which tracts play a role in regulating the extensor muscle tone, extensor tone? Vestibulospinal tract. Vestibulospinal tract is found in it is ventral to the ventral horn and it plays a very important role in regulating the extensor tone is what you need to remember. Which tract transmits the vibration sensation coming from the ankle, not hand? Gracilis. Remember, gracilis is ground, lower limb. Cuneatus is upper limb. Okay? Now, which reflex is monosynaptic in nature? Achilles reflex, otherwise ankle jerk reflex. It is a myotactic monosynaptic reflex that is mediated by the cord segment S1 is what you need to remember. Now the segment 4, what is the segment 4, doctor? It is loop of Henle. So what do you see in loop of Henle? Sodium potassium 2 chloride co-transporter is what you need to remember. Without a question on nephron physiology, there is no question paper in FMG, NEET PG. So you're all going to make me a promise that you are going to do a thorough revision of the nephron physiology. Please go back to onlinembbs.com video library and take every opportunity to do a revision of nephron physiology if you have done the questions wrong in this full-scale grand test. What is this organelle which is being shown to you in the image? What is this? What is the function of it? Electron transport chain. This is a biscuit question. Organelle in mitochondria. The release of the synaptic transmitter by this process which is shown in this image, it can be blocked most effectively. How? By preventing what? By preventing the flow of the calcium into the nerve terminal membrane. So you should know neuromuscular junction physiology, right? Similarly, muscle contraction, excitation. This is one important topic. Very well discussed in the onlinembbs.com video library. Please take a chance to kindly revise this very important topic. So the whole purpose of these YouTube sessions is to remind you, to inspire you to go back and do the revision on the video library of the onlinembbs.com, where 30,000 MCQs discussion is available and almost 3,000 video lectures are available, PowerPoints, almost 2 lakh PowerPoint slides are there for you to do the revision. Oh, it's an ocean. But the question is, it's not the quantity that is important for becoming a topper. It's the quality. Don't read what you know. Don't read. Don't touch also. Don't see also what you know. Everybody will know 60 to 70% of what is asked in the NEET PG entrance exam, because we all passed MBBS exams. 20 to 30% of the 953 topics, bilkul clean bold. You should know. For everybody, those 300 to 350 topics out of 953 topic list I have given you. It is different from Ramu, Somu, Ina, Meena, Rekha, everybody. It is different. So the most important thing that you need to do is, you should first recognize what are those 300, 350 topics out of 953 topic list where you are not really doing good. So that is the reason we have 2 ways to discover them. One is called Q scanner on the onlinembbs.com, which has got about 20,000 MCQs organized as 200 section tests. And every question is labeled which topic it belongs, so that whenever you do wrong in that section test, it will tell you, hey, you are good in this, you are bad in this. It will point you. It will give you a scanning report for you. Then you have 65 full-scale grand tests. Every Sunday, 1 full-scale grand test from April to November 30 and December 1 to December 30. Every day full-scale grand test and discussion. So these are 2 important benchmarks which will wake you up from the sleep, precipitate where you are going wrong, and stimulate you to go back and fill those gaps. That is most important. Of course, on the top of it, almost more or less every day, we take opportunity to discuss with you questions, some important, most commons, etc., to spice up your preparation. Okay, doctor? So that is the reason always it is a combination required. You should have a good online video library of the high-yield topics discussion, questions discussion, mock test, scanner, everything. But to stimulate you to read every day, you need to have this kind of a live online interactive session every day. With this combination, have 3 to 4 good friends on the side of you, with whom you prepare together. 6 months you give time to Dr. Murali Bharadwaj. I will take you to make you the topper in the upcoming NEET PG and FMG. Yesterday, one of our students, Dr. Jagadish was from Usmania Medical College. So one of a very sincere student. So he took 2 attempts, but in the 2020 attempt, he got in Armed Forces Medical College, Pune, in MD General Medicine. So I'm so happy to see his message. Sir, I made it happen in Armed Forces Medical College, and thank you to spend time with me, to study along with me. The role of a teacher is to study along with you. Most important, doctor. So when you see teachers studying with you, you also feel like studying. That's the only purpose of having a teacher, mentor, trainer, etc., etc. We are like a mental physiotherapist for you, right? So, doctor, how many hormones are produced? Typically, anterior pituitary produce 5 hormones: LH, GH, FSH, PRL, TSH. Now, these are the various phases of the cardiac cycle. So, you are being shown the phase D. The phase D is isovolumic relaxation. Isovolumic relaxation. That is, the heart is preparing itself to receive the blood, to start the diastole. So, typically, that leads to opening of the atrioventricular valve, so that at the end of the isovolumic relaxation, when the pressure in the ventricle falls down and already atrium is fully pregnant with the blood, with high pressure, it opens the AV valve and pushes the blood into the ventricle, is what you need to remember. Good to see 001. So, doctor, atrial systole, isovolumic contraction, ventricular ejection, isovolumic relaxation, and ventricular filling. So this entire cardiac cycle is one of the top priority topics in the tomorrow's NEET PG FMG exam. In the absence of vasopressin is antidiuretic hormone. If antidiuretic hormone is there, it is the distal convoluted tubule, which is the predominant spot for reabsorption of water. But in the absence of vasopressin, it is the proximal tubule, which is the most important site for the absorption of the water. What is the important role of the segment 5? Segment 5 is distal convoluted tubule. It is important for the secretion of the ammonia. You know how are H plus ions handled, doctor? H plus is acid. So it should combine with NH3 to form NH4 plus. And that NH4 plus is excreted into the urine, is what you need to basically remember. Now what you are seeing here is syringe. Syringe is based on what principle? Syringe is based on Boyle's law. So Boyle's law is one of the three gas laws. P1 into V1 is equal to P2 into V2. When you press, how the air is moving? Pressure volume relationship. What is this arrow shown in the figure? Typically, it is shifted to right. It typically occurs whenever there is an increase in body temperature, the right shift in oxygen dissociation curve. So right shift means decreased affinity for oxygen. Left shift means increased affinity for oxygen. Hemoglobin pakad ke baithega oxygen. Now, high arterial PCO2. What is an important cause? The moment the medullary respiratory center becomes depressed and respiratory depression occurs, that leads to respiratory acidosis, because there is a development of hypercapnia is what you need to remember. Prolactin does not have a releasing factor which causes it to be released. But which factor is responsible for the release of the prolactin? Vasoactive intestinal polypeptide. So, Jahanjit Sheikh is saying, sir, your previous image-based question has mistakes. Oh, is it? I mean, is it in our full-scale grant test? I'll just check into that. Definitely. Thanks for the feedback. Now, doctor, what is higher, a total lung capacity than its residual volume? Anatomical dead space. Anatomical dead space. So, typically whenever the lung compliance is decreased, the lungs become stiffer whenever they achieve a higher volume. So, expanding the lungs lowers the intrathoracic pressure, which causes the airways to expand. And expanding the airways increase their volume, and therefore the volume of the anatomical dead space is what you have to remember. Now, an increase in P50 of an oxyhemoglobin curve would result from decrease in what? Typically, any acidosis. P50 indicates the affinity of hemoglobin for oxygen. A decrease in affinity results in an increase in P50 is what you have to basically remember. The work of breathing is determined by elastic forces and airway resistance to airflow. Now the question is, which will increase the airway resistance to airflow? Typically, any mucus gland hypertrophy, mucus oversecretion, as in the case of the chronic bronchitis, will lead to increased airway resistance is what you need to remember. Insulin regulates the glucose transport into the muscle and fat cells. Through which glucose transporter, doctor? It is through the GLUT4. So you should remember the glucose transporter GLUT4 is translocated into the cell membrane, where it promotes the glucose uptake by the facilitated diffusion is what you have to remember. Good to see 31 online students. Please inform your classmates that the live class has started. Capillary permeability is lowest in which location? Obviously, there's a blood-brain barrier in the brain. That's the reason capillary permeability is lowest. So you should know different types of capillaries. There are continuous capillaries, which are typically found in skin and muscle, where there are gaps between endothelial cells in brain capillaries between the endothelial cells, whereas in the brain capillaries, there are no such gaps. That's a point you need to appreciate. A metaphase-blocking drug dose of colchicine works by what mechanism? Basically, it is the tubulin polymerization. Tubulin polymerization, which is inhibited by the colchicine, is what you need to appreciate. If you do an appropriate stimulation, a neuron may react to impulses which are summated at the axon hillock. Summation of these will result in depolarization of the initial segment. And what does it generate? Typically, summation generates action potential, is what you need to remember. Shift to right, just before we have seen. Any acidosis typically will shift to right. Inappropriate transient relaxation of the lower esophageal sphincter typically is responsible for the heartburn. Now, eating which of these following things will lead to reflux esophagitis by diminished lower esophageal sphincter tone? It is the chocolate eating. A lot of times after eating a chocolate, we gorgeously eat, but after that, there's a lot of reflux. Chocolate, ethanol, and fat. They're the common foods that diminish the LES tone and lead to heartburn, is what you need to remember. Good to see Shweta Rao, Yugender, and many more. Johan Jep. Can you please, where did you find image-based questions with mistakes? So, is it in the full-scale grand test or in the Q scanner? Where exactly? Can you please mention? Now, if the concentration of the potassium outside a neuron were to increase from 4 to 8 milliequivalents per liter, what will you expect to happen to the minimal stimulus required for the initiation of action potential? That means, what happens to the refractory state is a very important question. So typically, the minimal stimulus required for the initiation of the action potential will decrease if the concentration of the potassium outside the membrane increases from 4 to 8 milliequivalents per liter. Yeah, 001 is saying, sir, I remember the days of Kahoot quiz. What chalu honge or later after some months. Definitely we will make a start. You know, Kahoot is a very good way to competitively students all competing and ignited to answer the questions. Definitely, that's a very good quizzing that we had done in the past. So now, the resting membrane potential increases from minus 91 to minus 76 millivolts. The amount of energy required to cross this threshold and to initiate the action potential will decrease from 30 millivolts to 15 millivolts, is what you need to remember. Always, action potential is controlled by sodium. Resting membrane potential is controlled by, the resting membrane potential is controlled by the potassium. is what you need to remember. A skeletal muscle fiber has A bands. Beautiful question. These are 0.6 micron length. I bands 0.6 micron long. H bands 0.4 micron long. Now the examiner's question is, Anju Khan is saying, sir, we want most common in every subject. Correctly, definitely. Thank you, Anju, for your feedback. And I have seen Dr. Ravi Kiran orthopedics 2-hour session. Almost 18 students punched compliment. Excellent, sir. Super, sir. I was thinking, when I deliver a lecture, no one writes a compliment. Is it because I'm too bad or too good? I don't know. But anyway, your compliments always are the driving force for a teacher also. So Dr. Ravi Kiran said, sir, 18 students have complimented. I'm so happy. And I like to make it a much better session in the next session, which is going to come up, right? So let us study together. Whenever you take a test, take the score seriously. Find out where you are going wrong. Go back and improve those topics. That exercise should go on and on and on religiously, doctor. It is very, very important. So now let us talk about this interesting question. The sarcomere length is how much? Prema is giving a good compliment. You two are good, sir. Okay. Thank you, Prema. Shweta is saying you are awesome. Okay. Thank you. So maybe after the lecture, under the video, if you type that compliment, that will remain forever as a review, right? Veena says, too good, sir. Good. So only questions, answers is quite boring, that's why. Okay. So definitely, we will spice up the subject in different formats, right? Sometimes we will take a theme, like 1,000 image-based questions and discussion. Most commons, investigation of choice, treatments, like that we will try to classify the data of the same 20,000 questions only. Any teacher has to teach them. Any student has to study those 20,000 questions which are there in the Q scanner. There is no other way. Okay, so but what is most important is how much you are able to get the logic, list to remember, numericals to remember, etc., etc. Okay. Now, now, what is the sarcomere length here? A band plus half the I band plus half another I band. So in this case, A band is 0.6 and half the I band is 0.6 divided by 2 is 0.3. So 0.6 A band plus half the I band, which is 0.6 into 0.6 plus half the other I band into 0.6. So that will become 0.6 plus 0.3 plus 0.3. Together it will make 0.12. Barabar? I mean 1.2, right? So now the H band represents the area. If you look here, the H band, H zone, it is the area containing only the myosin, So subtracting 0.4 from this 1.2 will give you a total length of 0.8 of the actin in the sarcomere. Since the actin is attached to the Z disc at each end of the sarcomere, actin, where is actin? Actin is attached to the Z line on both the sides. It is necessary to divide the total length by 2 to determine the length of each filament. So that is the reason 0.8 divided by 2 is 0.4 microns is the length of each of the actin filament. Are you able to get it? Once more, I will repeat for you. Sarcomere length क्या होता है? A band plus half the I band plus half another I band. Here A band is given as 0.6. Another I band is 0.6. So half. So A band 0.6 plus half the one I band. So you have the A band plus half one I band. Another half of the other I band will give you the length of the sarcomere. You all agree? So the sarcomere length came out to be 1.2. The H band represents the area containing only the myosin. So subtracting 0.4, the H band, from this 1.2 microns of the total sarcomere will give you the area occupied by the actin filaments. So that is typically 1.2 minus 0.4 will give you 0.8. But 0.8 is the area occupied by two actin filaments. So one actin filament is 0.8 divided by 2. That is 0.4. So that is how you will remember this question. Chronic administration of which drug will lead to sustained increase in serum gastrin? Proton pump inhibitor. Proton pump inhibitor. So basically, proton pump inhibitor decrease the HCl production. So typically in the stomach, the acid levels will come down. So high acid suppresses serum gastrin. Low acid stimulates serum gastrin. So that hypochlorohydria, a chlorohydria induced by the proton pump inhibitor stimulates the gastrin and lead to development of hypergastrinemia is what you need to remember. Which steroid hormone mechanism is necessary for DNA binding within the nucleus? So basically, the steroid hormone typically forms a hormone-receptor complex, and steroid hormones all act at the level of the nucleus level. That's the reason if you give corticosteroid, immediately effect is not shown. It has to go through the cytoplasm, reach nucleus, act on DNA, make DNA replicate, then only its effect will appear. Now what is the structure which is indicated below? It is a purine. So you should know how to differentiate based upon the number of rings. Purine or pyrimidine. So now, what are all those enzymes in glycolysis which are allosterically regulated? One of the favorite questions of the examiner. Hexokinase, phosphofructokinase, and pyruvate kinase, they're all allosterically regulated in the glycolysis. If you have done this question wrong while solving the mock test, then you need to go back and do the revision. Very important. Of the topic of glycolysis. Glue. Typically, which vitamin deficiency? Folate deficiency lead to fig glue excretion into the urine. So form-imino-glutamate is formed during the histidine metabolism. Form-imino group is removed by the tetrahydrofolate to form N5 form-imino tetrahydrofolate. If there is a folic acid deficiency, this cannot happen, and this fig glue accumulates in the urine is what you have to remember. A 7-year-old female patient was brought to the hospital, markedly distended abdomen because of the hepatomegaly. There is hypoglycemia after fasting. lactic aciduria, hyperlipidemia, hyperuricemia, gout. After telling gout, if you can't recognize one guy, you missed the story. So if you have done this question wrong in the Sunday full-scale grand test, please go back and do a revision of glycogen storage disorders. Is the topic that you need to crack. Going back to the video library, right? So every full-scale grand test doctor, pick up 10 to 15 topics. भैया मैं a 300 MCQ solve करने के बाद 150 clean bold हो गया, 150 only I could score. So that means at least 10-15 topics I have to pick up and need to improve. That's the whole purpose of the full-scale mock test. Pyruvate carboxylase is activated by acetyl-CoA. So you should know fructose 1,6-bisphosphatase. If you look at the gluconeogenesis, how can you go back the glycolysis, do a reverse engineering and reproduce the glucose? Fructose 1,6-bisphosphatase is inhibited by fructose 2,6-biphosphate, AMP, and it is activated by ATP. And pyruvate carboxylase, it is activated by acetyl-CoA. So whenever you are fasting, there is a lot of lipolysis. And why lipolysis occur? Because when you are fasting, you have low insulin. Insulin is a lipogenic hormone. No insulin, low insulin prefers lipolysis. And whenever lipolysis is happening, a long chain fatty acid is broken down and forming a lot of acetyl-CoA. And all that acetyl-CoA accumulates, and that typically acts on pyruvate carboxylase. Hypervitaminosis A lead to metabolic bone disease, hyperostosis, etc., etc. Vitamin A intoxication lead to injury to lysosomes. Biologically active molecules of vitamin A, retinol, retinal, and retinoic acid is what you need to basically remember. Good to see 32 online students. Please inform your friends in WhatsApp groups that live class and Sunday test discussion started. Now, rhodopsin, typically retinol is the component. Vitamin A is stored mainly as retinol esters, where in the liver is what you need to remember. Vitamin B12 is absorbed from ileum, biscuit question. Biotins, carboxylation, all carboxylation reactions, biotin is the coenzyme. Once more, let me tell you, doctor, vitamins is the favorite topic of the examiner. Then hydroxylysine, all hydroxylation reactions. It is the ascorbic acid which is important. Collagen defect is a feature of osteogenesis imperfecta and even scurvy also. Vitamin which is excreted in the urine is vitamin C. A, D, E, K, they are all fat soluble. Active form of the vitamin is 125 dihydroxy vitamin D. Glycine to become serine. For that conversion, what do you require? You require folate. So it is a methylene group from N5, N10 methylene tetrahydrofolate. Converts the simple glycine to convert into serine is what you need to basically remember. In one carbon metabolisms, what is the amino acid involved? Folate is the amino acid which is involved. Which vitamin for post-translational modification of the coagulants, clotting factors? Vitamin K. Hemorrhagic disease of the newborn is vitamin K. Vitamin K is required for carboxylation of the glutamic acid residues, which is critical for the calcium binding function of the clotting factors, is what you need to remember. Which will act like a cofactor after modification, pantothenate. You all know very well coenzyme A, pantothenic acid. So, then one more favorite question. Zinc is a cofactor for the alkaline phosphatase carbonic anhydrase and LDH. Copper is a cofactor for the cytochrome oxidase. For the cytochrome oxidase, and cytosolic superoxide dismutase is what you need to remember. Which is a coenzyme but not a cofactor. Pyridoxine. So what is a cofactor? What is a coenzyme? Cofactor is a non-protein chemical compound which is bound to the protein, and it is required for the protein's biological activity, is what you need to remember. Whereas coenzymes are also non-protein part of the enzyme, and they are the prosthetic groups. So what are the features of coenzymes? They are important for the group transfer. They are heat stable, low molecular weight. They combine loosely with enzymes. If you do dialysis, enzyme, coenzyme can be separated. And after the reaction is complete, coenzyme is released from the apoenzyme and goes to some other reaction. So you should know cofactors, coenzymes, competitive, non-competitive antagonists, everything, anything in biochemistry, doctor. Now, the type of biomedical waste, what are you seeing here? Placenta. So it is category number 1. So placenta is being shown, it is a human anatomical waste which is included in the category number 1, is what you should remember. A diabetic patient taking antidepressant presented with the teeth condition which is being shown to you. What is the most likely organism? Streptococcus mutans. So the patient is suffering from dental caries, and the most common bacteria is mutans streptococci. What is its appearance in the stack culture which is being shown? Which organism? It is Bacillus anthracis. So what are some things about Bacillus anthracis, doctor? First, pathogenic bacteria to be seen under microscope. First demonstration of the blood-borne transmission, it is anthrax. The first bacteria shown to cause a disease and proven Koch postulate. And the first effective vaccine is against the anthrax. It is gram-positive rod, aerobic bacilli, heat-resistant spores, non-acid fuzz, non-motile, and capsule. What does it contain? Poly-D-glutamate protein in anthrax capsule. McFadden's reaction, where polychromatic methylene blue demonstrates the capsule of the Bacillus anthrax. Medusa head colony on the solid medium. And plet agar is used to grow it. Polymyxin, lysosome, EDTA, thallus, acetate. Gelatin stack culture, it will show inverted fur tree appearance, is what you need to remember. And if you grow it on a culture media, pearls like pearls, nizam ka pearls, pearls, string of pearls appearance, and penicillin is effective. Like that, doctor. 10 golden points, 10 to 15 golden points आपके मुट्ठी में रहना. कल के examiner scratch करे तो you should tuck like a generalized tonic-clonic seizures. You should present all the points and you should look which point the examiner is going to ask. Attack the examiner, not afraid. Oh my God, anthrax came. I thought of reading, but I did not read. No, not like that. Microbiology, disgusting subject. Still, you should love it, you should like it, you should kiss it, you should have it. There's no go. Only close your eyes and remember, you are going to be a cardiologist, you are going to be a neurologist, you are going to be a cardiothoracic surgeon. If you smell the dream closing the eyes, all that lethargy, भाई मैं नहीं पढ़ सकता हूँ, मेरे बस में नहीं होता, वो सब चले जाता. It's all psychological, doctor. Depression is purely psychological. It's all, it is inevitable. When it is inevitable, just enjoy it. Make it a fun and make it happen. So that's most important, right? So what is true about this condition? Typically, it is caused by human herpes virus 3 because that is chickenpox, also called varicella, itchy red blisters that appear all over the body, is what you need to remember. What is the following culture appearance on the solid medium? So I want to once more tell you, if you solved our Sunday full-scale grand test every Sunday or ceremoniously, 300 questions, 150 tappad mil gaya to. If you are clean bowled 150 times out of 300 questions, then you will get inspiration to this whole discussion looks interesting. So ideally, I should conduct this discussion on Sunday itself, afternoon, but somehow a lot of things are coming up and I'm unable to. So definitely morning 9 to 12 test, afternoon 2 to 5 discussion every Sunday. We will make it a point. So that hot you can finish the discussion after solving the paper. So Bacillus anthracis, the medulla head colony appearance is being seen in this image, characteristic of Bacillus anthracis. Now which organism produce this kind of colonies? Group A is Streptococcus. So you should know how to recognize alpha hemolysis, beta hemolysis, gamma hemolysis, the 3 different types of hemolysis of the cocci. So doctor, alpha hemolysis, if the agar under the colony is dark and greenish, partial hemolysis. Streptococcus pneumonia and a group of oral streptococci called Streptococcus viridans, alpha hemolysis partial. Beta, complete hemolysis. So the whole area appears yellow, transparent. Streptococcus pyogenes, group A, beta hemolytic. Streptococci, they display beta hemolysis. Gamma, there is no hemolysis at all. So Enterococcus faecalis belonging to group D Streptococci. Staphylococcus saprophyticus, Staphylococcus epidermidis, gamma hemolysis. So doctor, Streptococci, Staphylococci, gram-positive, gram-negative, classification, characteristics, the table is there, no? The one who could not conquer that table of differentiating gram-positive, gram-negative cocci, Streptococcus, Staphylococci, you are not even within the reach of entrance, qualifying an entrance if you have not read that. Microbiology, lousiest subject. But if you are very good focus, what are the few things that you want to read, master, expecting the exam, you will become the winner, doctor. So alpha hemolysis, beta hemolysis, and gamma hemolysis, you should know how to recognize. 50S ribosomal subunits, they're found in bacteria. Group-specific streptococcal antigens, they're all basically, the classification is based on the carbohydrates. Now, Th2 cell cytokines, they induce B cell transformation and proliferation. When there is an apoptosis, there is a DNA fragmentation and membrane blebbing. Most fetal thymocytes die before leaving the thymus. They're all true. But you should remember, Th1 cells secrete cytokines which are important for cell-mediated immunity. Whereas IL-4, IL-5, IL-6, they are cytokines active in the humoral immunity to produce antibodies. Once more, go back to the onlineMBBS.com video library and do a revision on. Interleukins is a favorite topic. A bacterial toxin with a super antigen activity, it is produced by whom? Staphylococcus aureus, lead to toxic shock syndrome. Martin Lewis, they are used to isolate Neisseria. Polymers of N-acetyl glucosamine, N-acetyl uramic acid. When are they found? Typically, they are all found in the cell wall. They are polymerized and they form the peptidoglycan backbone of the cell wall, is what you need to remember. The bacterial structure needed for adherence are the pili. Gram-negative organism found most commonly responsible for pneumonia and cystic fibrosis. What is the virulence factor which is important for the colonization and maintenance of this organism in the lung? Basically, two organisms, Dr. Staphylococcus aureus, Pseudomonas aeruginosa are the main pulmonary colonizers that lead to pneumonia whenever there is any cystic fibrosis. Pseudomonas is gram-negative. It produces slime alginate, slime material alginate that produce the resistance to the phagocytic killing and poor penetration of the antibiotics to the site is what you need to remember. What is a major marker which is retained in all the peripheral T cells? CD4, 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 CD4. Without a question on CD4 markers, are there Ans June 2020 who are though? I'm not Murli Bharadwaj, right? So definitely I got one question. CD3. CD3 is written on all peripheral T cells and serves as a marker for the total T cell enumeration whenever you have calculated. Cytotoxin, enterotoxin, neurotoxin is Shiga toxin. So both the Pseudomonas, exotoxin A, diphtheria toxin, what is the common thing for both of them? They both inhibit protein synthesis by inhibiting the elongation factor 2. Then Shiga toxin is a cytotoxin, enterotoxin, neurotoxin. Vibrio cholera, enterotoxin and E. coli, labile toxin. They both will increase cyclic AMP. One question aega, Ames June 2020. Definitely आने वाला question है one toxin का mechanism of action. What is the factor most important to trigger a granulomatous reaction to wall off and contain the infection? Cod factor. Cod factor triggers the Th1 response, which helps to contain the infection, is what you need to remember. A patient develops diarrhea 5 days after starting antibiotic for staphylococcal infection. Antibiotic associated pseudomembranous colitis, Clostridium difficile, biscuit question. The drug which is highly bound to albumin It cannot leave the plasma into surrounding tissues. That's the reason it is bound to have a small volume of distribution. A subject in whom, this is a beautiful question, doctor. Super duper question. A subject in whom the renal clearance of the inulin is 120 ml per minute, barabar. The clearance of which is found to be 18 milliliters per minute. If the drug is 40% plasma protein bound, how much filtered drug had been reabsorbed? Who is going to give me the correct answer? I'll just get some water. Meanwhile, keep punching your answers. Who is going to give me the correct answer? Correct answer. Yes, doctor. So, Yugender Bobby arrived at 72 ml. Kochi Machan is proposing 36 ml. Okay. Nobody said D. Oh my God. No worries. So, what is the formula for clearance? Filtration fraction into glomerular filtration rate. The drug is 40% brown, so filtration fraction obviously is 60%. So glomerular filtration rate is 120 ml. So 120 ml per minute into filtration fraction 60% is equal to 72 ml per minute, which is supposed to be theoretical clearance of the drug. But actual clearance is how much? Not 72, it is 18. That means you are expecting from the glomerular filtration, you are expecting the drug to be coming out to 72 ml per minute. But only 18 ml only came out. That is the reason 54 ml per minute is getting reabsorbed. That is how you conclude. बिल्कुल समझ में आ गए? All of you understood the point, right? Okay, आगे बढ़ेंगे. If anybody did not understand, please punch. At 6 hours after IV administration of a bolus dose, the plasma level of the drug is 5 milligram per liter. If the volume of distribution is 10 liters, elimination half-life is 3 hours. What was the dose administered? बच्चों, प्रॉब्लम ले लो और मुझे आपका आंसर बताओ. इजी क्वेश्चन, कॉन्सेप्ट है तो फटाफट आंसर कर सकते हैं. कल के एम्स एग्जाम में जरूर आने वाला क्वेश्चन है बाबूजी. Come on, who is going to punch me the answer? So if you have done these questions wrong in the full scale grand test, doctor, see that pharmacokinetics, extensive discussion was done in the video library. You need to go back and do the revision. Yes, doctor. Come on, punch your answers. So you should remember, at 6 hours after IV infusion, right? At 6 hours. Half-life is how much? 3 hours. That means how many half-lives pass? 2 half-lives pass. The plasma level is how much? 5 milligram per liter. That means at the start, initially, it was 20. 20 ban gaya, 10, 1 half-life over. 10 ban gaya, 5. another half-life over. So 2 half-lives are over and it became 5 milligram per liter. That means at the start it was 20 milligrams per liter. That is, concentration at the initial concentration was 20 into volume of distribution. Volume of distribution was given as 10 liters. So that is the reason 20 milligram per liter initial concentration to 10 liters is equal to 200 milligrams is the initial dose. Okay, doctor? So please take every chance to subscribe to online mbbs.com video library. East and West, the best resource for you. And also subscribe to 65 full-scale grant tests. NEET PG full-scale grant tests and discussions. From April 1st to November 30. Totally 35 tests. December 1st to December 31st. Every day one test and discussion. Totally 65. And also there is a 20,000 MCQs which is available as the Q scanner, which will give you an ability to know which topics you are doing wrong. So totally 20,000 MCQs are organized in like 100 section-wise tests, and every question is being labeled which topic it belongs. So as you finish the 100 MCQ test paper, you will be knowing analysis of your performance. So these are the things that are going to help you, supplement you, complement you to become a topper. Right, doctor? So also, please tell your friends about onlinembbs.com, and we all wish to get the good news that you are becoming the topper. You have becoming the top. You have become the topper. That's what we are waiting for. Alpha-1 agonists cause reflex bradycardia. How can you prevent it? How can you prevent it? You can do that by giving atropine. Why? Alpha-1 agonists, what do? Whenever alpha-1 receptors are stimulated, there is a vasoconstriction. That vasoconstriction increases the mean arterial pressure. And the mean arterial pressure is carried by the vagus. Is sensed by the glossopharyngeal, and vagus will go to the heart and typically lead to bradycardia reflex. But that bradycardia, vagus means it is cholinergic transmission. That can be prevented by giving anticholinergic, like atropine, is what you have to emphatically remember. Before an eye exam, a patient is given a drug that causes mydriasis, that has no effect on accommodation. Mydriasis, pupil dilatation, doctor. Pupil dilatation when it occurs if you stimulate sympathetic or if you inhibit parasympathetic. Either of the two will lead to mydriasis. You all agree with me? Big pupil is mydriasis. But if you give a drug like tropicamide, right? Basically, neostigmine, pilocarpine are cholinomimetic. So they lead to meiosis, not mydriasis. Tropicamide, phenylephrine. This is anticholinergic, this is sympathomimetic. So anticholinergic mydriatics not only lead to mydriasis, but also they lead to loss of accommodation. Because accommodation is also mediated by parasympathetic. Whereas phenylephrine does not affect accommodation, but only lead to mydriasis is what you have to basically remember. Outpatient prophylaxis which you give in SVT. How can you achieve that? Basically, diltiazem, calcium channel blockers, they are the ones for outpatient prophylaxis against development. Acutely, whenever there is a supraventricular tachycardia and nodal tachycardia, you give adenosine, which is given intravenously. It is of short duration. Whereas the beta blockers, calcium channel blockers, they act at the AV node. And beta blocker like esmolol is too short acting to be used for prophylaxis. The only thing left over is a calcium channel blocker like diltiazem, Dilgem can be used prophylactically to manage the SVT, to create refractoriness of AV node is what you need to remember. Once more, doctor, SVT, VT is the favorite question of the examiner. Without that, there is no question paper. Please go back to the general medicine and do a revision. Which diuretic is most appropriate for a patient who is having hypokalemia? So if you look at furosemide, thiazide, spironolactone lead to hyperkalemia. Furosemide lose calcium, and furosemide and thiazide, both of them worsen the hypokalemia. So the best thing that won't affect it is acetazolamide, is what you need to remember. Which antibiotic lead to renal failure? All of you know. Aminoglycoside like gentamicin. So among the aminoacids which are ototoxic, which are nephrotoxic, which are both oto, nephro, and once more in the ototoxicity, which are cochleotoxic, which are vestibulotoxic, which are both vestibular and cochlear. Both cheezon hai, Dr. Saab, that you need to mug. There is no other way. So please go back to the onlinembbs.com video library and do a revision of whatever the topic you are feeling little tremble in the mock test. To treat obsessive compulsive disorder, we give sertraline, fluoxetine, sertraline. So you should know the classification of antidepressants, antipsychotics, anxiolytics, etc., etc. Little, Barter, Gentleman, इसके बिना क्वेश्चन पेपर नहीं होगा. Similarly, renal tubular acidosis type 1, type 2 differences. Without that, there is no paper. ये सब चीजों का डिस्कशन हम बहुत लगातार किए थे onlinembbs.com वीडियो लाइब्रेरी के ऊपर. Now, Liddle syndrome. Which diuretic is used to treat Liddle syndrome? They give triantrene. Now, doctor, Liddle's is also called pseudo hyperaldosteronism. It is autosomal dominant. It presents with hypertension. Obviously, aldosterone high means sodium retention, hypertension, and it's also with a low plasma renin, because this high aldosterone is not because of high renin. It also leads to metabolic alkalosis, hypokalemia. When aldosterone is high, sodium retention, potassium loss, so hypokalemia. But why is it called pseudo hyperaldosteronism? Because aldosterone level as such is normal or low. But still, why do you call pseudo hyperaldosteronism? Because what is the effect of aldosterone? It opens the sodium potassium pump, causes sodium retention, potassium loss into urine. So whatever the sodium channels in the distal tubule, they get opened by the action of aldosterone. Even without aldosterone only, they get a gain of function mutation, and they typically open up and leading to excessive reabsorption of sodium and loss of potassium. Even though aldosterone is not there, normally if aldosterone is there, then only the epithelial sodium channels which are there in the distal tubule, they are supposed to open and sodium is supposed to reabsorb. Potassium is supposed to be lost in the urine. Without aldosterone only, all that is happening as such aldosterone is high. That is the reason it is called pseudo hyperaldosteronism is what you need to remember. बराबर? समझ में आ गए ना? So dysregulation of the epithelial sodium channel because of a mutation of the chromosome 16, which happens in kidneys, lungs, and sweat glands. So you basically treat it because potassium is lost into the urine. You will give a potassium sparing diuretic like amiloride, and trimethoprim is what you need to remember. Good to find Ritesh Raja, Sweta Rao, Upender Bobby, many more who are all online. So, doctor, that brings us to the end of 100 questions, right? So, let us quickly take 2 minutes voice rest. Go to the kitchen, pick up a cup of tea, come back. Another 50 questions we discussed and call it a day. Okay, so please stay online and I will rejoin within another 3 to 5 minutes. So let us call it as intermission. Sholay movie mein intermission break. 5 minutes. Please stay online. I'm not yet done with you all. Okay, so 5 minutes break. I'll rejoin. Okay. So, welcome back, everybody. What is the treatment of the muscle spasm stiffness which develop in an antipsychotic receiving patient who developed them because of whatever the reason? Generally, antipsychotics lead to extrapyramidal symptoms that lead to development of a lot of dyskinesias. So, any other agent can worsen those extrapyramidal effects, but not the benzotropine. Benzotropine is used to treat what are the clinical triad of Parkinson's, Dr. rigidity, akinesia, tremors. Of all the three, it is the tremor which is most often effectively treated by giving benzotropine, is what you need to remember. A 60-year-old man presents with the complaints of nocturia, difficulty urinating, occasional urine dribbling because of the neurogenic bladder. So how do you treat him? So we give Beta-Carotene. So hypoglycemic awareness. Once more, Beta-Carotene is what, doctor? Beta-Carotene is cholinomimetic. A cholinomimetic contracts the detrusor and typically used to treat a neurogenic bladder where the bladder has lost its power to contract, is what you need to appreciate. For the loss of the hypoglycemic awareness, which agent is most likely responsible? If you give beta blockers in a person who is taking insulin, if insulin led to hypoglycemia, he will not be aware that he is becoming hypoglycemic because beta blockers are sympatholytic agents. And all that sympathetic activation is supposed to happen when you are going into hypoglycemia because of the insulin, that is prevented by the beta blockers, is what you need to remember. Which drug lead to hypokalemia, doctor? Always remember, beta-2 agonists stimulate the potassium to move from extracellular into intracellular fluid, and that predisposed to development of hypokalemia in those who are receiving the beta-2 agonistic agents as asthmatic drugs in intensive care unit. Hydroxyurea, where do you use? Essential thrombocytosis. The beta blocker timolol is contraindicated if the person is having bronchial asthma, is what you should remember. Very good. 26 students came back after interval. Very good. I thought nobody will come back after interval. I will be the only one who will do the revision and go. Good, good. So, in what situation do you use interferon alpha? Viral hepatitis, adverse effect of the class of antiarrhythmic agents that act by decreasing the slope of the phase 4 depolarization. What is that adverse effect? Typically, QT prolongation occur if an antiarrhythmic is causing decrease of the slope of the phase 4 repolarization. So that will predispose to torsidis depointis, is what you need to remember. Which condition predominantly lead to cupulo-interstitial involvement? Why is it important? You have a glomerulus, Bowman's capsule, tubule, lot of interstitium. Some pathologies, some conditions affect the glomerulus predominantly. Some affect the tubule predominantly. Some affect interstitium predominantly. Some affect tubule and the interstitium. Accordingly, you should know all renal pathologies, what do they affect? Remember, if you look at Sjogren's disease is predominantly tubulo-interstitial involvement, whereas the lupus involves predominantly glomerulus. That is the reason lupus can present with proliferative membranous changes and interstitial. Rheumatoid arthritis presents with amyloidosis. Cryoglobulonemic nephropathy, it leads to membranoproliferative lesion. Once more, take it as my word, doctor. Without a question on glomerulonephritis, एम्स एग्जाम नहीं होगा, नहीं होगा, नहीं होगा. शूट शॉट आने वाले टॉपिक है. Normotension, hypokalemia, metabolic alkalosis. If it is normotension, it cannot be, come on, answer me. If it is a normotension, not hypertension, it cannot be, just before we discussed, it cannot be hyperaldosteronism, that is Contains syndrome. It cannot be Liddle syndrome. Khali ek reh gaya. What is that? Bartter. So that is the one. Bartter lead to hypokalemia, metabolic alkalosis, just like Liddle, but normotension. Normotension is Bartter, hypertension, Liddle. You remember? Barabar? So, doctor, Bartter is because of a defect in the transporter in the loop of Henle. Bartter is like taking the loop diuretic. Always remember, Bartter is typically like taking loop diuretic. Gentleman syndrome is like taking thiazide diuretic. That means it affects mainly distal tubule. Bartter affects the loop of Henle. Loop of Henle. Okay, you'll remember that, right, doctor? So if you're taking loop diuretic, you are losing the fluid into urine. If you are losing the fluid into urine, there is no question of developing hypertension. That is the reason. Normotension with hypokalemia, metabolic alkalosis is equal to Bartter. Hypertension with hypokalemia, metabolic alkalosis is equal to either Contains syndrome or Liddle syndrome. Maza aa gaya na? Barabar? Once more, you are going to go back and do a revision in onlinemmbbs.com bit library. The extent of the liver damage done by chronic hepatitis B or C infection. How can you evaluate? You have to do a liver biopsy, obviously, to do the evaluation. That's the only way you can be able to judge whether cirrhosis is there. Clostridium difficile. How will you diagnose? You do sigmoidoscopy and you find pseudomembranes, which are a very important indication. Now, hepatitis virus that lead to chronic infection, chronic hepatitis, is HCV. A 16-year-old typically presents without any pubertal development. The baseline testosterone, LH response to LH-RH, what do you expect? And he's also having anosmia. Anosmia means Kalaman syndrome. So typically in Kalaman syndrome, there is a hypothalamic problem to produce the releasing hormones. That's the reason there will be low testosterone. Normal LH-RH response is what you need to remember, because LH-RH production is affected in Kalaman. A 35-year-old man presents with a stroke in the left parietal lobe. Prominent right ventricular impulse, fixed, widely split test tube, fixed, wide split is equal to auscultatory hallmark of atrial septal defect, which can lead to embolization. Breast cancer gene is there on the chromosome number 17. T922 is important for CML. 48-year-old undergoes endoscopy with epigastric pain, and there is an erythematous patch on the lower esophageal mucosa. Biopsy is taken. Elongation of the lamina propria, intraepithelial neutrophils, eosinophils, squamous epithelial hyperplasia. What is the most likely diagnosis? That is all suggestive of reflux esophagitis. Very good. Shweta rightly says ASD, wide fixed split, for our earlier question. The neurological examination shows that when a patient looks to the left, the right eye is not adducting, it is stopping in the midline. And the left eye, which is abducting, undergoes horizontal nystagmus. That is called internuclear ophthalmoplegia because of the medial longitudinal fasciculus lesion. So, which side medial longitudinal fasciculus? The side where there is an adductor lag. So, the right eye is having adductor lag. No, it is not adducting when the left eye is abducting. So, right side MLF lesion is there. So, that is what you need to remember. Very good. Jyoti Swaroop Appikatla is rightly saying it is MLF, but which MLF? The side where the adductor lag is there, Jyoti. Now, a prenatal triple screen was done. Alpha-fetoprotein is decreased, beta-HCG is increased, estriol is decreased. Which birth defect? So, doctor, please don't forget this important table. Sure short question in Ans June. You'll remember Dr. Murali Bharadwaj in the exam form. Down syndrome, AFP low, estriol low, HCG high, inhibin A high, everything high. HCG high, inhibin A high. Turner syndrome. AFP low, estriol low, HCG very high, inhibin A very high, almost similar to Downs. Edwards syndrome. AFP is not affected, but estriol low, HCG very low, inhibin A unaffected. He is low, is what you need to remember. Patau syndrome, jisko patana. AFP is increased, estriol is normal, HCG normal, inhibin A normal, only AFP increased. AFP Patau, right? So, AF, you can remember, AF Patau. Only AFP is abnormal, nothing else is abnormal. So, this triple screen, doctor, एक फुटमा ले लिया ना, definitely आने वाला question. Acute MI patient, diffuse ST segment elevation. That means there is a pericarditis. Pericarditis in acute MI is called Dressler's syndrome. So Dressler's syndrome is a complication expected 3 to 5 days after the acute MI is what you need to remember. Acute pyelonephritis, what do you get when you do urine analysis? You get WBC CAS. Antibody-mediated treatment for the Crohn's disease. What is it directed? It is directed against tumor necrosis factor alpha, TNF alpha, monoclonal antibodies like infliximab, adalimumab, satralizumab, golimumab. They are the ones which are affected. Cobalamin deficiency. What supports a diagnosis of cobalamin deficiency? Typically, vitamin B12, if it is not there, what do you get, doctor? Methyl malonic aciduria. Because methyl malonyl mutase required vitamin B12 as a coenzyme. A 9-year-old boy, ataxia, and hematocrit is 55%. Hematocrit is very low. Neurologist on gadolinium scan shows tumor in the brain. Biopsy of the tumor shows a vascular neoplasm. What is your condition? What is the condition that is there in your mind? Come on, punch your answer. Punch your answer, doctor. Jivka Verma, late but latest arrival at 11:30 p.m. Good, doctor. Any time is okay in love and war. So, but what is the, Jyoti, what is your answer? What is the condition? What is your diagnosis? What is this condition? With cerebellar hemangioblastoma. Where do you find cerebellar hemangioblastoma? Is my question to you, Jyoti. Come on. Punch your answer. Yes. Ataxia is there, but what is this condition? Brain tumor, highly vascular, foamy stromal cells. Right? You want to say ataxia, telangiectasia? No. It is von Hippel-Lindau syndrome. Von Hippel-Lindau syndrome is chromosome 3 is what you need to remember. A pregnant woman with prenatal examination, her uterus is larger than it should be. Her beta-HCG is elevated disproportionately. So typically in a molar pregnancy, what is the most common karyotype and most usual chromosome origin? So it is all paternally derived 46XX. So partial versus complete mole. You should know all the differences. Where is the uterus size proportionate, where it is disproportionate. Everything you should read, doctor. Now, the lungs shown here in the micrograph, where do you see? In wet drowning. It is also called emphysema aquosum. For those hyper-expanded waterlogged lungs which are seen in the case of the wet drowning is what you should remember. Now, what is this fingerprinting called? Dactylography. These two twins can have everything same, including the boyfriend, but not fingerprints. The sign shown in this photo micrograph typically is called tachynoia. So typically it is an important change post-mortem seen in the eye after the death. So there is a blackish band of discoloration zone called tachynoia, seen mostly 7 to 8 hours after the death is what you should remember. So what is this injury in the photograph below is basically called? It is typically seen with high temperature liquids where there is a formation of scalp. The first external sign of the putrefaction in a dead body is that greenish discoloration in the dependent part, in the cecum, in the right iliac fossa. Now, which condition will alter the fingerprint? Leprosy can alter the fingerprint. Now, these are the various changes shown after the death. So, what is the change to typically? It is a change of rigor. So, Peller mortis, alger mortis, rigor mortis, liver mortis, putrefaction, decomposition, skeletonization. That is the order of forensic medicine, death and autopsy. Now, what is the most common pattern of the fingerprints? Loop is the most common. What is this phenomena? बचपन में बीपी दिखे तो बड़े होने के बाद भी बड़े बीपी रहेगा. बचपन में अगर छोटा बीपी रहे तो कम बीपी रहे तो बड़ा होने के बाद भी कम रहेगा. What is this called as? This is called tracking phenomena. Initial low BP will follow same track in adult, and initial high BP will tend to become higher in adult life, which is called tracking. Now, doctor, in the disposal of the medical waste which is being shown in this image, Which colored bag? Black chick. Where is? Have you any wool? Yes, sir. Yes, sir. 3 colors full. So definitely one question, doctor. Exam chodega nahi about the different colors of the bags. So white translucent colored bag is used for the disposal of the syringes, is what you need to remember. What is this technique shown in my photo, in this photograph below, generally used for feeding? Low birth weight, premature infants. So any of you have taken this grand test in our online test engine? Did you get all these images clearly as what you are seeing here, or any problem in the images? Please update me. So doctor, this technique is called Palladi feeding. Palladi is a feeding device which is used in Palladi feeding. So Palladi is that low bowl with a spout shaped like Alauddin's lamp. It's called Palladi feeding, is what you should basically remember. Now doctor, the number of vaccine vials that should be kept in this equipment, 16 to 20. You should know cold chain, reverse cold chain, everything. Now doctor, what is this symbol? This is a symbol of biohazard waste. So what does the arrow in this image indicate? It means it should be discarded. Vaccine vial monitor is a favorite topic of the examiner, doctor. The color of the central square is lighter than the ring, it can be used. But the central space is same or darker than the ring. So there is a central one. If this is darker, then discard. For right-sided skew, what do you get? Median is smaller than mean. So mode more than median, more than mean. So this is the left, this is the right skew deviation. This is all qualitative data. Pie chart, spot, bar, but not scatter. Now, the number of malaria cases, 50 very small, 5,000 very big. That means the data is having the outliers. Either two small numbers or two big numbers, in that case always median. When the data is not uniform and you have outliers, extreme values, then median is a better one. A randomized trial has shown there is a difference, but in reality there is no difference. So what is that kind of an example? It's called type 1 error. Type 1 error, alpha error is false positive. Type 2 error, beta error is false negative. The error of concluding that there is a statistical difference, though there in reality there is not much. If somebody said taking coaching, going to face-to-face class, paying 70,000-80,000 rupees and taking coaching, it helped me, that is alpha error, false positive. Right? So, alpha error is false positive. Direct standardization is used to compare the mortality between two countries. When will you do that? If the age distributions are widely different. For example, if you go to Japan, every third person is above 60. Pura buddhe logon ka dunya hai Japan. And there are countries where young population like Korea is high. So if there is a difference in age distribution, then you need to do the direct standardization is what you need to remember. Now, if you are presuming the probability of a birth of Ladika, ya Ladiki, Raja or Rani, Rajkumar, Rajkumari is 0.5. What is the probability of a couple giving birth in successive pregnancy, all 3 male children? Each male child being born is 0.5. So, a boy born or a girl born are 2 independent events. So, if you want to know the probability of 2 events A and B which are occurring in sequence, if they are independent events, then the probability of A and B is P probability of A into probability of B. So 0.5 into 0.5 into 0.5 is equal to 0.125 is what you need to remember. According to the Central Birth and Registration Act, event of death, whether due to corona or no corona, you should register within 7 days. International health regulations, there is no risk of spread of yellow fever if the Aedes aegypti index remains below 1%. Japanese encephalitis, transmitted by culex, birds are involved, human is the incidental host. The pigs carry, but the pig's brain is not affected. There is no disease symptoms in the pigs which are carrying the Japanese encephalitis virus is what you need to remember. Total flea index means average number of all types of fleas, all species per rat is called total flea index. First of all, you should know general flea index, specific flea index, rodent infestation rate, etc. Epidemic typhus is carried by louse. Kala azar, aldehyde test, when will it become positive? It will become positive after 3 months. In trachoma survey of a community, inflammatory trachoma was 2%, cicatricial trachoma is 2%. Matlab, acute cases are 2%, chronic cases are also 2%. What does it mean? That the problem was prevalent in the past and still it is prevalent. Now, bacteriological index for diagnosing leprosy. What is exact? 2 plus का मतलब क्या होता है? Minimum 7 sites should be examined. B1 less than 2 is paucibacillary. Smear taken from multiple sites. 2 plus means bacilli found in all fields. 3 plus many bacilli in all fields. 1 plus is 1 or less than 1 bacillus in each field. Negative means no bacilli in 100 fields. You have to tuck in the nose and sneeze in the exam. There is no other way. Okay. Commonest venereal disease, gonorrhea. If you are taking antacid, if the acidity is less in the stomach, there's a greater incidence of salmonella infection is what you need to remember. Corpulence index, Quetelet index, all indices, you have to be very sure of, used in measurement of obesity. Quetelet, so you should know, Quetelet index is called body mass index. Weight in kgs by height in square in meters is body mass index. Broca's index, typically height in centimeters minus 100 will give you the ideal body weight. Lorentz formula, typically it is also for obesity. Corpulence index, actual weight by desirable weight divided by desirable weight should be less than 1.2. Ponderal index is height divided by weight to the power of 1/3 is what you need to remember. Height independent is corpulence. Beautiful. Jyoti Jidawar, sterilization beds program. Typically, to provide sterilization facility in hospitals wherever they are not available is the main objective. How much basal body temperature increase with ovulation? 0.5 degree Fahrenheit. So that brings us to the end of the May 31st Sunday full-scale grand test, doctor. So thank you all for a patient listening. And I wish to see you all every day in our live online broadcasted session, studying together, spending 1 to 2 hours together, getting re-energizing ourselves to become better every day. That is a prayer to the God before we go to sleep. Thanks for joining my bedtime story before you go to sleep. Good night.